This is a special edition of Late Night Health. I'm Mark Allen. We're going to go to Hawaii, where we're going to spend some time with a friend of ours. He's been on the show before, Dr. Jacob Teitelbaum, a board-certified internist. He's one of the most frequently quoted integrative medical authorities in the world. He's written more books than we have time to talk about. But we're going to talk right now. Let's start with our COVID-19, and then Dr. Teitelbaum will be back very soon, and we'll talk about fibromyalgia, which is one of his specialties. Nice seeing you again, Dr. Teitelbaum.
Mark, always a pleasure to be with you and with the gang. So for those of you out there worried about the COVID-19, we're going to talk today about how most of you can just kind of sail through it and do really, really well. It doesn't have to be difficult or scary.
And that's the thing. We've done some interviews on how to reduce stress now because of this. It's a pandemic. I don't know what they're doing in markets right now in Hawaii, where you're based, but here on the mainland, at least in Southern California, they're passing out gloves, masks. They are hosing down the carts before you get them. They're limiting the number of people in the stores.
Mm-hmm.
Is this all a good idea, a good practice, doctor?
I think for now it's very, very prudent. The whole social distancing, if you see a store that's wiping down and disinfecting the handles of your shopping cart, go there. They care about you and they want you to live through this thing. So, it's just some common sense things. When you're out and about, generally hang out at home. When you are out and about, though, and there's times it's fine. In other words, people say, "Can I go for my walks?" Of course, go for your walks. That's a really healthy thing to do. Just keep social distancing. If you're passing somebody, keep a couple feet between you. I mean, you're walking within 6 feet of them. The virus isn't going to jump on you, but you don't want them to cough on you. So just reasonable social distancing. In Hawaii, we tend to be huggers instead of doing the Hawaii shaka now. That's the thing. It's all good. So you can be out and around in those ways. Just don't congregate. And
I have to say that I was out for a walk the other day, and in walking, I saw people in my neighborhood, and they would smile, they would wave hi, and
mm-hmm,
I'd walk around them, they'd walk around me.
yep.
If nothing else,
Mm-hmm,
there's a positive side of COVID-19. People
mm-hmm.
are being helpful and friendly.
Yes, they're being more gracious to each other, and that's what we're seeing here as well. So here's the thing to remember when you're out and about. If you're going to touch something that other people have touched, you may pick up the virus from that, and then it goes to your mouth, and hoop, there it is, as they said a long, long time ago. So don't touch stuff if you're walking. If you're having doorknobs or door handles or things like that, take a paper towel or something with you, or I have little alcohol wipes. I just wipe it down and use those to touch things. ATM terminals, credit card terminals. I just use a little alcohol swab. You can just have some tissues with you or a paper towel and just touch it with that and toss the paper towel. So don't touch stuff that other people are touching. And for the little things that you are going to touch, you're picking up a can in the supermarket or whatever, avoid hand to face. That's the main reason for the mask. And also so you don't cough on others. So it's funny, when you see somebody wearing a mask, or when you're wearing a mask, kind of like they're saying, I know the mask doesn't help me, so I'm wearing the mask to say, I love you. I don't want to give it to you. But
What a
when you
good approach. Oh, I like that a lot.
Yeah, and then when you come home, just before you touch much in the house, just wash your hands. Put away the groceries, throw away the bags and everything that you touched in the outside world, including food containers for carry out. Put on a plate, wash your hands, and now you're keeping your house COVID-free and relax and enjoy. So just simple common sense. It doesn't need to be, oh, my God, kind of stuff. But but that you've heard about. But here are simple things you can do that'll make one to realize perspective. The media is wonderful at scaring people to death, so you watch 24/7. That's their job. If you think
Oh
that
boy,
it's the truth,
yeah.
I've got a bridge in Brooklyn to sell you. It's not. It's a dramatization. It's a fiction. It's been that way for hundreds of years. How did Mark Twain say? That if you don't read the news, you're uninformed. But if you do read the news, you're misinformed. And Jefferson was less gracious than that. So
Right.
they're meant, they have the job to do. It's not to inform you. If a dog bites a man, that's not news. Any news editor will tell you that. Man bites dog, that's
Aha.
news. So you're going to think reading the news that men are running around everywhere, but to the dogs, no. So is COVID a concern? Of course it is. But let's put it in perspective. You have far more people killed each year from malaria than from COVID in the
Even
United
now in
States.
the 21st century?
Even now in the 21st century, by far, you will have about twice as many people to 4 times as many people die from hepatitis in the United States this year than from COVID. Um, heart attacks will be about 3, 4 times as many. So
What
just put
about
it in
the
perspective.
general flu? Regular, I'm calling it regular flu.
60 to 80,000 deaths last year. So we're looking at 100,000 to maybe 200,000. So it's not that much more severe. So the question is, why are we on lockdown? Well, because this flu has a thing. Most people do fine. 80% of people, it's just this mild crud, no worse than a regular flu. But for a small percent of people, it attacks the lungs, so the lungs shut down. And that requires intensive care unit and ventilator. You don't see that with the regular flu. So the regular flu becomes a different thing, and where the person dies, but they don't end up taking up an intensive care unit bed and a ventilator. So the lockdown is to avoid overwhelming the hospitals.
Right. As an integrative physician, you blend allopathic and alternative health.
Mm-hmm.
So in our previous discussions, you start with natural things, and if they don't work, then you move to penicillin.
I
I'll
go,
just use that as an example.
I'll go with the penicillin first if it's the best choice. Somebody has
Got it.
pneumonia, I'm going to give them the vitamin C and all the kind of nutrients to help, but I'm putting them on the antibiotic right away. For many things, though, if they have high blood pressure, I'm going to go naturally first. For diabetes, I'm going to go naturally first. So it's not a matter. I like natural because it's safer and usually more effective than medications, but I'm going to use whatever the best, safest tool is for the job, as opposed to what most doctors are trained to do, which is to use what's most profitable for the drug companies. They don't realize that most of our physician education is how New England Journal of Medicine editor put it, slick advertising masquerading as science. And
Right.
that's virtually all of our continuing medical education. So anyway, blah, blah, blah.
Yeah, I
But
got
let,
that. I'm curious though. You said that 80% of the people who get it,
yeah,
they
no
may
big deal.
not even know they get it then. I mean, they may go,
Many don't,
and that's
many,
it.
many don't know they have it. Many it's very mild. Sometimes it's like a bad flu, but for 80%, it's just no big deal. And you know, so I would treat this kind of like the regular flu, but with a little more caution. And let's go through some things you can do that will really help your immune system, keep you safer, and keep you in that 80%.
Okay.
Put very simply, number one critical thing: zinc is poison to this virus. If you have a zinc lozenge in your mouth, you can get high enough concentrations that if you happen to get some of the virus in, there's a good chance it will kill it before it ever gets into your body beyond that. So when I'm out and about, I have these little zinc lozenges. I pop one in my mouth, and I have that when I'm around other people.
I have a question about zinc.
Hmm.
Okay. Um, it can affect smell and it can affect taste, especially.
Hmm.
And I eat because I like to taste the food. We were talking about that before we started. I miss some food, but
Yep.
with I'm taking zinc. I if I take it for too long, especially, it can last for weeks. Is there anything I can do about that?
Lower the dose. In most people, it's inadequate zinc. It's zinc deficiency that affects the smell and taste. In fact, if somebody comes, they say they're losing their smell and taste. Well, now you think it's a coronavirus, um,
Huh, yeah.
but in general, it's zinc deficiency that causes that. Now, if you're finding that you're getting the zinc and you do that, then lower the dose, because that's very unusual. It's usually the other way around. That
Interesting.
low zinc causes loss of smell and taste.
And of course, I guess you could be tested for zinc You can't be,
Oh, you can be, but they're
but it's
garbage.
not necessary.
They're
Okay,
not
got
reliable.
it. All right, I didn't want to interrupt, but I know that a lot of people have that problem. The other thing with zinc, it can upset my tummy because I am a very sensitive person, as everybody knows.
So here's the thing. Start with a multivitamin. There's a wonderful multivitamin that I use that is, I designed that. My royalties go to charity. It's called the Energy Revitalization System Vitamin Powder. One drink, and it's not expensive, and it replaces literally 50 pills a day. And I'll give you the challenge for the viewers. If you can go ahead and figure out how to get what's in that one drink in less than 35 to 50 pills a day, I'll give you a free bottle. Nobody's done it ever. And I lecture to PhD nutritionists and all the rest frequently. Most people like take 60, 70 pills to get what's in it.
Got it. And the name of
So
that is?
the Energy Revitalization System vitamin powder. You can get it at endfatigue.com. So E, N like Nancy, D like David, and then the word fatigue.com. Um, and that's what I take each morning. I take that, and I take a scoop of shine ribose and a rhodiola ashwagandha mixer. That's kind of my energy thing. But for getting your immune system really strong, uh, I usually, for the multi, it has 15 milligrams of vitamin D. I mean, 1,000 units of vitamin D, 15 milligrams of zinc, 500 milligrams of the vitamin C, and some vitamin E and vitamin A. So those are the five biggies in keeping viruses at bay and optimizing your immune system. So for everybody now, I recommend the Energy Revitalization System vitamin powder. And just for everyday health, people find that they just feel fantastic. They feel so much better on it. Uh, and for the coronavirus, I recommend adding another, so you're getting a total of 15 milligrams of zinc a day for 1 month. For those of you with sensitive stomachs or your taste goes, just lower the dose. Even what's in the vitamin powder will be enough in those cases. I've never seen that affect people's taste.
Got it.
And it's strong nutrition, so some people get gas or stuff, in which case cut the dose to half a scoop a day. But that's a really simple way to begin. Those simple nutrients really will not just turbocharge energy and often help pain go away, but also optimizes immune function. Um,
Other supplements or anything else? What about exercise?
well, exercise is good. That's why we're saying go out for walks in the sunshine. So that's a very healthy thing. Andrographis has not been tested that I've seen specifically for COVID-19, but I think it's just a good overall immune booster. So I go with the Andrographis, the 200 milligrams to 400 milligrams, not twice a day. And we have that on our website. That's easy to find anywhere. So
What
again,
about oil of oregano?
no, that's more bacterial. I'm not
Okay.
impressed with that. And if you really love the taste of oregano, uh, because I find when I take oregano oil in the past, I'm glad I like Italian food because I am burping up and tasting oregano all day.
Yes,
So
that does happen.
yeah,
Yeah, it does
so
happen.
so mostly I go with these elderberry. Again, there's been, because of the cytokine storm issue and the rest. I personally am taking elderberry right now. I take the 300 milligrams a day. But the key thing is the zinc, 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 plus some vitamin C.
Gotcha. Gotcha.
Now,
How
at
much C? How much C a day?
500 milligrams a day, and at first sign of viral infections, I bump it up to 500 to 1,000 milligrams 4 times a day.
Got it.
I have people take 50 milligrams of zinc for 1 month, and then I go ahead and have them drop to the 15 that's in the vitamin powder. Um, and then at first sign of viral infection, I will take it back up to the 50 for the next month. Now, the other two key things, there's a triad when people get symptoms. If they get the cough, they get the shortness of breath, they get the fever, even the nausea or the diarrhea. Most people tend to start about 60% 50 with the achiness, headache, achiness. That's also a symptom that it's maybe coming. I Right now, most of you have heard the controversy about the malaria medicine, hydroxychloroquine or Plaquenil,
Right.
combined with Zithromax. And again, I don't, I abhor the virus being politicized. This is a time for us
Mhm.
to drop the politics and come together and use common sense and science. And
Right.
it kind of blows my mind that right now, I find myself agreeing with the president on a medical issue over the head of the NIH, Dr. Fauci. Dr. Fauci is saying, well, there's no evidence. No, his definition of no evidence, this is key to understand. His definition of no evidence means we don't have large, double-blind, randomized, placebo-controlled studies of thousands of people.
Right.
So anything less than that is no evidence. So if we're on a boat out on the bay and it started taking on water and they were handing out life jackets, he was saying, there's no evidence that life jackets and life preservers help. We have to wait and do 2 months, 3 months to randomized double-blind studies. Don't put on the stupid life jackets. They're unscientific. There's no evidence. That's exactly what's going on here.
So
It's
are you saying that I mean, are they using the malaria vaccine as a
not vaccine, medication.
medication for somebody who has COVID-19,
Hmm.
a serious case of it, rather it's not a preventive?
Well, there's some evidence that it may act as a preventive, and there's a large body of scientific data showing that it works. Now, the data is suggesting that it works best if it's used early, just like any infection. If you have pneumonia, you want to go to the antibiotics early, not when the person's on the ventilator. Yes, no, when you want to start.
Right.
So the same with this. And there are over 1,000 cases now in case series and published studies showing that it decreases the time of being contagious from 22 to 40 days without the treatment to 3 to 5 days with the treatment, which is
Wow.
massive if we're looking at coming off of lockdown at some point. And it suggests that it makes the illness much, much milder. So to me, the pharmacies are sold out now, but that's okay. They will be back in stock probably within a few weeks. And the to me, that's a no-brainer. If I have somebody I'm treating and they are starting to have symptoms and they can get the Plaquenil and the Zithromax, and a number of my patients already have it, people I treat, because this is something that I've been talking about for weeks now, then they should start. And the dose that I use is Plaquenil 200 milligrams, 2 tablets twice a day the first day, and then one twice a day for 5 days. Main
Those
side
are
effects.
the medications that we're talking about.
These are the medications. So if your doctor will prescribe it, but again, for the next few weeks, it may be hard to get, but then the pharmacy should be having it back in. I will add Zithromax, 1 Z-Pack, just follow label directions. To me, this is a no-brainer. Now, you may have heard in the media, well, it's going to make you go blind. Anybody in the media who is saying that, this is wonderful that they're saying this, because it will tell you right away that whoever is saying this cares nothing about you or the truth. Okay. Very simply, the vision problems that you hear over and over, and I don't care if they're respected media, I don't respect them anymore if they do that. There are over 10 million people who have taken these short-term doses for malaria. You know how many cases of vision loss they've seen in those 10 million cases?
No, zero.
Zero.
Got it.
It's only when people are taking it for at least 2 years and usually over 5 years continuously. That's the only time that a small percent get vision loss. Same with the cardiomyopathy and heart issues with the Plaquenil. Over 10 million cases where they've monitored and looked. Do you know how many had the abnormal heart rhythms and heart problems?
Zero.
Zero.
Zero again. Interesting.
Okay. Where with ibuprofen, you know how many people die in the United States from heart disease from ibuprofen each year?
Thousands.
30,000 plus. So just to put a little perspective here. Now, so when the media is telling you this, it's one thing if they're making you blah just to get you so you can
Right.
watch and they can sell advertising. But when they're willing to risk your life by misinforming you, I would simply call them and say, I've decided not to watch you anymore. There have been no cases in the scientific literature. Your misinformation could kill me and my family. And thank you for letting me know I'm not watching you anymore.
Do you
So
watch the news?
no,
No. It's as somebody who's worked in the news,
no,
it's becoming more difficult.
it's a fiction.
It just is. more difficult. We were going to do 10 minutes on COVID. We've already done 25.
Let's
So
move it
what
on.
we're going to do is we're going to stop, and Dr. Teitelbaum is going to come back, and we're going to do a program on fibromyalgia and fatigue. Both of those, because you're a specialist in that area as well. All right, I'm Mark Allen. This is Late Night Health. Join us at latenighthealth.com, and you can also visit us on all the social media, or most of them anyway. Twitter, what's another one? Facebook. And do you have something from memory on social media? There's all that. We're on all of it, and also on
the Vector Mega for your fish oil.
Yeah, got it. I didn't take mine today. And the other is podcasting networks like Apple Podcasts, Google Play, and those. So, all right. I'm Mark Allen, along with Dr. Teitelbaum. We'll be back in just a little bit. Bye-bye for now.